Hypoglycemia and diabetes are two distinct conditions related to blood sugar levels, with hypoglycemia characterizing abnormally low glucose levels, while diabetes is primarily associated with high blood sugar levels. Hypoglycemia symptoms include shakiness, sweating, confusion, and in severe cases, even loss of consciousness, whereas diabetes symptoms often entail frequent urination, increased thirst, unexplained weight loss, and fatigue. Treatment for hypoglycemia involves quickly raising blood sugar levels through foods or drinks high in sugar, whereas managing diabetes typically requires a combination of diet, exercise, monitoring blood sugar, and possibly medication or insulin therapy. While hypoglycemia can occur in anyone, it is most common in individuals with diabetes, especially if they inject insulin or take certain oral diabetes medications. Conversely, risk factors for developing diabetes include family history, obesity, and a sedentary lifestyle. Here's a more detailed look at the distinct aspects and interrelations of these two conditions. Glycemic control, overproduction of insulin versus insufficiency or resistance. Hypoglycemia and diabetes present contrasting challenges in glycemic control. Hypoglycemia, characterized by abnormally low blood sugar levels, can occur when the body produces too much insulin or when dietary glucose is insufficient. It can cause symptoms like shakiness, confusion, and even loss of consciousness. In contrast, diabetes, typically marked by high blood sugar levels, stems from insufficient insulin production in type 1 diabetes, or the body's resistance to insulin in type 2. Chronic hyperglycemia from diabetes can damage blood vessels and nerves, leading to complications such as heart disease, kidney failure, and retinopathy. Managing these conditions requires a delicate balance, ensuring sufficient insulin to prevent hyperglycemia without tipping into the risks of hypoglycemia. Blood sugar levels, acutely low versus chronically high. When comparing hypoglycemia and diabetes, it's crucial to recognize that hypoglycemia refers to an acutely low blood sugar level, which can cause immediate symptoms like shaking, sweating, confusion, and even loss of consciousness. This condition can occur in people with diabetes as a side effect of insulin treatment or other medications, but can also affect non-diabetics due to various reasons, including dietary choices or hormonal deficiencies. On the other hand, diabetes typically involves chronically high blood sugar levels due to the body's inability to properly use or produce insulin. Over time, this chronic hyperglycemia can lead to severe complications, including neuropathy, retinopathy, kidney damage, and cardiovascular disease, necessitating a broad and long-term management strategy targeting lifestyle changes, medication, and regular monitoring. Trigger factors: excessive insulin or lack of food versus inadequate insulin or insulin resistance. Hypoglycemia and diabetes, while related to blood sugar regulation, present contrasting trigger factors. Hypoglycemia arises often due to excessive insulin in the bloodstream or a lack of food leading to insufficient glucose. This condition can cause a rapid decline in blood sugar levels, resulting in symptoms like shakiness, confusion, and even loss of consciousness. Conversely, diabetes stems from inadequate insulin production in type 1 or insulin resistance in type 2, leading to persistently high blood sugar levels. Complications from diabetes can be severe and include cardiovascular disease, nerve damage, and kidney issues. Understanding these triggers is crucial for diagnosis, management, and treatment. Symptom onset: rapid and sudden versus gradual and progressive. Hypoglycemia and diabetes present contrasting dynamics in how symptoms appear and evolve. In hypoglycemia, symptoms can manifest abruptly, often catching individuals off guard. A sudden drop in blood glucose levels can trigger a cascade of acute symptoms, such as shaking, sweating, dizziness, and intense hunger, necessitating immediate action to avert potential danger. Conversely, diabetes develops insidiously over time, with symptoms like increased thirst, frequent urination, and fatigue unfolding progressively. This slow onset can deceive sufferers into overlooking early warning signs, delaying diagnosis and intervention, whereas the stark immediacy of hypoglycemia's impact usually demands swift recognition and response. Primary management: immediate glucose intake versus long-term blood sugar regulation. Hypoglycemia and diabetes represent opposite extremities of glucose imbalance. In hypoglycemia, Urgently restoring glucose levels is crucial to prevent cognitive impairment, seizures, or even coma. Immediate intake of fast-acting carbohydrates such as glucose tablets or juice provides rapid relief. Conversely, diabetes requires meticulous long-term blood sugar management. Chronic high glucose levels necessitate a comprehensive strategy emphasizing diet control, physical activity, monitoring blood sugar, and potentially medication or insulin therapy. Both conditions demand acute awareness, but differ fundamentally in their temporal approach to management. One demands rapid intervention, while the other emphasizes sustained lifestyle adjustments and consistent medical treatment to maintain glucose homeostasis.